Introduction chlorine gas inhalation. Chlorine gas is a commonly used industrial and household chemical, but it becomes highly toxic when inhaled. It reacts with moisture in the airway from hydrochloric and hypochlorous acids, which can cause injury to the mucosal lining. The effect of official vary. Case may only cause coughing or throat irritation. Moderate exposure can lead to shortness or breath and bronchospasms. It's important to note that symptoms might be delayed, so careful observation is necessary even after mid-exposure. What is chlorine gas? Chlorine gas is a yellow-green toxic gas first discovered in 1774. It's mainly used for disinfecting water, making bleach and producing plastic like PVC. While chlorine gas has many useful applications, it's extremely hazardous when inhaled and can cause severe lung damage. Historically, it was used as a chemical weapon in World War I, but today strict regulations are in place to ensure its safe use.
Historical event involving gas chlorine. Let's start by looking at the historical perspective on chlorine gas. During World War I from 1914 to 1918, chlorine gas marked a turning point in warfare. It was one of the first chemical weapons used on a large scale. The gas was released manually depending on wind to carry it toward enemy trenches. Unfortunately, Allied soldiers were completely unprepared and lacked any protective equipment. This horrific use of chlorine gas showed the devastating potential of chemical warfare and its deadly impact on human health. Case background review. Now let's look at our case study. A young man working at a chemical plant accidentally inhaled chlorine gas. Initially, he presented with mild symptoms such as coughing and shortness of breath. He was kept under observation for 8 hours and later discharged. However, within just 5 hours, his condition worsened. He turned with symptoms like chest discomfort and noticeable swelling in the neck. This delayed reaction highlights how chlorine gas exposure can continue to affect the body even after initial signs seem manageable. 5 hours after the initial discharge, the patient came back with more severe symptoms, sudden chest tightness, shortness of breath, excessive sweating, and swelling in the chest and neck area. On examination, subcutaneous crepitus was felt. This is air trapped under the skin, indicating internal air leakage. Chest and neck X-rays confirm subcutaneous emphysema and pneumomediastinum. A CT scan showed air leakage near the trachea, suggesting a possible tracheal rupture. However, there were no signs of chemical pneumonitis or ARDS. This shows the importance of follow-up and imaging in patients exposed to chlorine gas, even if initial symptoms appear mild.
Let's take a look at what happens when chlorine gas is inhaled. When inhaled, chlorine enters through the nose or mouth and reaches the lungs. It reacts with moisture in the respiratory tract to form hydrochloric and hypochlorous acid, both of which are corrosive. This causes immediately symptoms such as the burning sensation in the eyes, nose, and throat, causing chest tightness and even chemical pneumonitis or lung inflammation. What's more concerning is that symptoms may worse hours later, even if the person appears fine initially. This is why close observation after exposure is crucial. Now let's talk about treatment. The first step is immediate first aid. Remove the person from exposure and bring them into fresh air. Then, decontaminate by removing contaminant, clothing, and washing the skin. If the gas affect the eyes, rinse with true saline or clean water for at least 50 minutes. In terms of medicine, corticosteroid like dexamethasone can help reduce lung inflammation. Analgesic may be given to relieve pain and discomfort. Antibiotics are only necessary if there is secondary bacterial infection. Quickly respond and proper can significantly reduce the severity of chlorine gas poisoning. Safety precaution for chlorine gas. First, workplace safety. Ensure good ventilation in area using or storing chlorine gas. Second, personal protective equipment (PPE). Wear a full face respirator or gas mask. Approved filter. Third, in case of exposed or leak, seek immediately medical help. Lastly, training and emergency prep. Conduct regular safety drill.
Here we see the hierarchy of control, which is a system used to minimize or eliminate exposure to a hazard. It ranges from most effective to least effective. For example, first, elimination. For physically removing the hazard. Second, substitution, replacing the hazard with a safer alternative. Second, engineering control. For isolating people from the hazard. Fourth, administrative control, changing the way people work through policy or procedure. Lastly, personal protective equipment or PPE, using gear to protect individuals as last resort. In conclusion, chlorine gas inhalation poses serious health risks even if symptoms appear mild at first. At this stage, show delayed complications like continuous pneumomediastinum and trachea injury can occur. Key takeaways include the importance of yearly recognition, continuous monitoring, and prompt medical intervention. Preventive measures such as training, protective gear, and working smartly in high-risk environments are essential in minimize harm.